Good morning, everyone. 24 cases overnight, 18 of them linked to current exposure sites or identified close contacts, and 6 remaining under investigation. Fortunately, 15 of the 24 were in quarantine during their entire infectious period. We believe at least 6 spent part of their infectious period in the community, and 3 remain under investigation. 15 people are hospitalised as of this morning, and we have 4 in intensive care, with 1 requiring ventilation. Testing numbers were very strong again yesterday, nearly 3,400 tests conducted. On the compliance front, we'll be joined this morning by Chief Police Officer Neil Gagan, who will provide some further information on ACT Policing's compliance activities. But the headlines are 625 traffic stops with 4 directions to leave the Territory, and around 90 business compliance checks. One of the priorities for ACT Police and WorkSafe ACT today and over the next week is to focus on compliance in the construction sector. Now, a lot of work has gone into the development of the COVID-safe requirements to allow the construction sector to return. These guidelines are in place to protect construction workers, but also to protect the broader community. These requirements will be strictly enforced, and Chief Police Officer Gagan will provide some further information shortly on ACT Policing's approach to ensure that the guidelines are complied with and that we can continue to have safe construction activity occurring across the ACT. There's 20,000 jobs associated with the safe return of the construction industry. Turning now to vaccinations, some very good news on vaccinations today as our rollout really starts to ramp up. So just over half of the ACT's population aged 16 or over have now received 2 doses of a COVID-19 vaccine. We are the first jurisdiction in the country to reach this important 2-dose milestone for our 16+ population. Over the weekend, we are on track to reach the 75% first dose milestone for our 16+ population. We now have 70% of Canberrans aged 12 years and over with their first dose, and we have been vaccinating vulnerable 12 to 15-year-olds for some weeks now. The 12+ population, which is approximately 365,000, is the denominator that the ACT uses in our calculations for vaccine efficacy across the population. And this is a reminder that it takes about 2 weeks for the vaccine to be effective after you've had your jab. And so when we talk about milestones and figures, we are looking at the 12+ population 2 weeks after we cross the headline thresholds, because the vaccines are not at full effectiveness until 2 weeks after you've had your jab. What we're going to see in the coming weeks is our vaccination rates continue to climb steadily. And I'm pleased this morning to be able to announce thousands of additional vaccine appointments are now available at the AIS Mass Vaccination Clinic. So more than 30,000 additional appointments are open over the next 6 weeks and were added to the My Digital Health Record system this morning. Text messages have already been sent to people who were already in the system, those who've been waiting the longest, and they have had first access to these additional 30,000 bookings. Anyone who is currently booked for their Pfizer vaccination at an ACT government clinic in the weeks and months ahead can log into the My Digital Health Record system at any time in the weeks and months ahead to see if there is an earlier vaccine booking available. It's quite likely that there will be. So for people who have bookings in October and November, over the next week or 2 or 3, please check, because there may well be earlier appointments available. Now, to be clear about this process, the system allows 100 users to reschedule their appointments at the same time. So if you are outside of the 100 who are on that site, you will be placed in an online queue. Now, the queue does move very quickly. These 30,000 new appointments are anticipated to speed up our vaccination program by around 2 weeks. However, I repeat the point I've been making every day, that for many people aged 18 years and over, the fastest way to get vaccinated, to get fully vaccinated, is to talk to your health professional and get an AstraZeneca vaccine today. There are appointments available today. So for those who have joined late, we recorded 24 new cases. The good news, though, that is a high headline figure, but the good news is that 18 of them were linked and 15 of them were in quarantine during their entire infectious period. Those high levels of linked and in quarantine are the good news out of today's headline number. But there were still at least 6 infectious in the community. 3 are still under investigation, and we are starting to see the impact of the cumulative caseload, with now 15 people in hospital and 4 in intensive care. Dr. Coleman will provide a further update on the new cases and the epidemiology of the outbreak. Minister Stephen Smith will then provide an update, and the Chief of Police, Neil Gagan, will also provide an update, and then all of us will be available for questions. Thank you very much.
Good morning, everybody, and thank you, Chief Minister. As you may know, I'm Karen Coleman, and I'm the ACT Chief Health Officer, and I'm just going to reiterate some of the key numbers that the Chief has just read out. So the ACT has recorded 24 new COVID-19 cases since our update yesterday. This brings our total to 463. With 13 more having recovered over the last 24 hours, we now have a total of 225 now recovered. This leaves our active case number now at 238. Of the new cases today, I can confirm, of the 24, 18 can be linked to known cases or ongoing clusters, while 6 remain under early investigation. And of those 18, we know that 16 remain as household contacts. So this still remains our principal known mechanism of transmission. Out of the 24, 15 were in quarantine during the whole infectious period, and reassuringly therefore pose no risk to the community. Of the remaining 9, 6 did spend time in the community for at least part of their infectious period, and 3 remain under early investigation. As mentioned, we have 15 people in our hospital. 4 of these are in ICU, with 1 of them requiring ventilation. Of this 15, 11 are unvaccinated, 3 are partially vaccinated with 1 dose, and 1 is unknown at this state. Our youngest patient in hospital is under 12 years of age, and the oldest in their mid-70s. As of 8 p.m. last night, the total number of people hospitalised is 42 across both the Canberra Hospital and Calvary Public Hospital in Bruce across the whole outbreak. We have had a total of 6 people requiring intensive care treatment, with 3 requiring ventilation. And to provide some further information regarding our outbreak, I know that many of you have been interested in the vaccination rates of our positive cases. This information is from the Australian Immunisation Register, the AIR record on COVID-19 vaccination, so it is validated and confirmed. So approximately 361 of our 463 total confirmed cases are unvaccinated. So that is 78% of our total cases in the ACT through this outbreak are unvaccinated. Of these 361 unvaccinated cases, 339 of them are under 49 years of age. That's 89% are under 49 years of age. This is not unexpected, given 84% of our confirmed cases in the ACT are aged under 45 years and actually haven't been eligible for vaccination for as long as the other age groups. Additionally, as we report every day, you will have heard that the vast majority of cases hospitalised are either unvaccinated or partially vaccinated. So I think all of this together supports the importance of getting vaccinated as soon as you possibly can, not only to help protect yourself from severe illness, but also to protect those of us who are unable to get vaccinated in this time, and particularly noting children under 12 years of age. Let's talk a little bit about our outbreak analysis and our cases of confirmed and that have links and source unknown. So of our 463 total cases, 414 of them this morning are linked to known cases or clusters. That's 90%. 40 are currently unlinked, or we don't know the source of these 40 cases. Additionally, 9 remain under an initial investigation, and 7 of these 9 are actually from the last 48 hours. So as before, this is our ongoing updating and moving of these numbers as we move forward. We now have just over 1,200 self-identified close contacts that we are supporting in quarantine and over 360 active exposure locations. There are no additional active public sites of transmission to raise your awareness of today. And overnight, we have linked 3 new cases for Bidfood Canberra. These are all household contacts, so not unexpected, and bring us up to 12 cases linked to this cluster. So just finally, I'm really happy to see the interest in the daily shout-out that the community has shown, and I must say that I am incredibly grateful to the whole team. But I don't just mean the ACT Health team or even the ACT Government team, but I mean each and every essential worker who continues to get out there every day and keep Canberra running during this period of time. I know these people aren't necessarily doctors and nurses and public health people who are probably used to getting out there during these kinds of time, but there's a lot of people working behind the scenes, and we couldn't do what we're doing without them. So my shout out today is to all the organisations continuing to look after our furry friends during lockdown. This includes the wildlife teams and rangers at ACT Parks and Conservation, the rangers at Domestic Animal Services, the teams and volunteers at ACT Wildlife and RSPCA, as well as the staff at Canberra Zoo and Aquarium. I'm not sure whether our furry friends do feel anxiety, but they must know that something different is happening at the moment. So thank you to all these people. Thank you very much. I'll hand over to Minister Stephen Smith.
Good afternoon, everyone. I just want to start with an update on the announcement we made yesterday around Check-in Canberra. So I'm pleased to say that yesterday more than 3,100 requests were received for the new Check-in Canberra card, and the team will start issuing that card from Monday. Also pleased to say, news in from the Android user in my family that the updates to the app are now available for Android phones as well. So just to advise people, we do push out those updates to both Apple and Google at the same time, but sometimes there's a difference in timing of when they become available. As we all know, in managing this outbreak, Delta has changed a lot about the way COVID-19 is managed and what it looks like when we have an outbreak in our community. And we also know that testing is a key part of tracking and managing COVID-19. So I'm pleased to announce today that we are going to have a significant increase in our testing, assessment, pathology testing capacity in the ACT. During this outbreak, testing peaked for our pathology team at more than 5,000 tests per day. the team is now installing 2 new testing machines to boost delivery to 10,000 COVID-19 tests a day if required. So there's a fully automated high throughput PCR device. Now you'll be familiar with PCR testing, which arrived earlier this week, and also a robotic handling system which will come online soon. They'll both be installed in ACT Pathology's molecular lab at Canberra Hospital and complement the Panther machine that was installed last August to help boost the lab's COVID-19 testing capacity. So this will mean more rapid intelligence on COVID-19, which will help our contact tracers to track the movement of the virus. It will mean reduced waiting time for the results, which can also provide faster reassurance to Canberrans and help them manage during uncertain times. I want to give a huge shout out to the staff at ACT Pathology who have been working around the clock under enormous pressure over the last few weeks in particular. This new technology will help them to manage their workload by taking less time to prepare samples and give them more capacity to process more tests. I'm going to hand over to the Chief Police Officer, but before I do that, I'd also like to provide you with a quick update on our health workforce. Currently, about 100 Canberra Hospital staff are in isolation or quarantine, and in Calvary Public Hospital, this is now down to fewer than 20. So it's great to see that this number has come down significantly over the last 2 weeks. To date, we've had a tremendous response to the call out for staff who can put their hand up to help with the pandemic response. Canberra Health Services has received more than 1,300 applications so far. And of these, around 370 staff have been brought on board already, and recruitment for an additional 50 nursing staff should be finalised this week, and they're planning to bring a further 250 on board over the next month to meet demand. But that's obviously not everybody who's put their hand up, and I do want to thank every single person who has put their hand up to help out. Obviously, processing those applications does take some time, but thank you to everybody who has indicated their interest in supporting the COVID-19 response. This increased workforce will have the extremely important job of helping to surge up our vaccination program, as well as to safely staff our COVID-19 testing centres. So with that, I'll hand over to the Chief Police Officer.
Good afternoon, everyone. I'm Neil Gagan, Chief Police Officer for the ACT. Firstly, I'd again like to thank Canberrans for their efforts over the last few weeks. Clearly, vast majority of Canberrans are doing the right thing when it comes to adhering to the health directions. Today, I'd like to talk about what our focus will be in the coming weeks in relation to compliance. We will continue to focus on the wearing of face masks, and we'll also continue to monitor the border in relation to our anywhere, anytime traffic stops, which will add to the 16,000 compliance stops we've already undertaken since the lockdown commenced. As the Chief Minister has already stated, a significant focus of ACT policing with our partners at WorkSafe ACT over the coming weeks will be on building compliance. Now, we obviously have existing powers under certain legislation, but what I really want the focus to be on is the building sites, particularly to make sure they wear masks, make sure they're actually adhering to the guidelines that they help draft. So basically we're asking them to follow the rules that they've been consulted with to ensure that we all stay safe. We have the ability, I should say, to actually issue fines up to $200 for people that fail to wear masks, $1,000 for individuals who fail to comply with the health directions, and up to $5,000 for a business that actually also fails to comply with the health directions. And before I hand back to the Chief Minister, I just want to make it very, very clear that power does exist under current legislation that enables us to shut down a building site for serious non-compliance where there is found to be a threat to public health. Now, clearly, we do not want to shut down building sites or residential building sites or large commercial building sites, but I want to make it very clear that we will not hesitate to do so if we need to ensure public health is maintained. And on that, I'll hand back to the Chief.
Thank you, Neil. We'll happily take questions.
Chief Minister, do you intend to keep doing these COVID daily updates in the coming weeks?
Yes, we will continue daily updates. Whether I am at every single one, I think I'm up to nearly 30 in a row. We'll soon make a judgment call in the coming weeks. It's possible that we may not do 7 days a week, that we might certainly will do weekdays, but we may slow down a little on weekends later in the month and into next month, but that will depend on the circumstances. But no, we will continue to be available and to provide regular updates. Clearly there's bigger announcements and more information available on certain days than on others, and I would observe that there's some repetitive elements of press conferences, but it's often the case when there's a change of journalists on the weekend.
Chief Minister, the additional vaccination appointments at the AIS, can you give us some more clarity around those? Are those Pfizer-only appointments, and how have we been able to add so many new appointments?
Yes, so this is the UK, our share of the UK batch, and that they're arriving on a weekly basis. A even larger number of new appointments will be available through the GP network. So the Commonwealth is providing the ACT across all of our distribution channels with those extra doses that have been secured in the swap with the UK. They're all Pfizer, and they will be delivered through a combination of our clinics and through the GP network.
What does it do for your modelling for when we'll hit those 70% and 80% targets? Have you got any firmer dates on those?
Oh, as I indicated in my opening remarks, it brings things forward by a couple of weeks, but that's really more in November. There's some additional that we can do each week, about 3,000, but that doesn't dramatically alter the timeframes through through October. We're in September now. It's been a long journey, and we will. But I would anticipate this extra batch would mean that you'd be able to get through the bulk of the program rather than it running into December. It's likely to be able to be concluded pretty well in November.
Will you start thinking about booster shots then, perhaps as soon as the end of the year?
I think the current thinking on that and the available vaccine supply, because of course part of the swap with the UK is that we've got to give them 4 million doses back in December. So I suspect that part of the thinking here will be around available supply, priority around booster shots. I suspect it is an early 2022 issue there.
Chief Minister, New South Wales has moved to set a date for all schools to reopen, with the government saying that these school communities, need more certainty around when they can return to face-to-face education. Is that something the ACT government's also likely to set in place?
We will provide further information in relation to schools next Tuesday when we provide the update then.
And do you agree with the sentiment that businesses need less certainty around when they can reopen?
So that business needs less certainty.
So,
I think everyone would like as much certainty as we could possibly give. I would love absolute clarity on exactly everything that's going to move and shift over the next 3 months here in New South Wales, in the nation. I'm never going to get that. This virus, this pandemic takes interesting twists and turns, and often from one day to the next things can change dramatically. So there's no government in Australia and no government in the world that can give absolute ironclad guarantees on every single thing that everyone wants an answer to, because we just don't know yet. But as each day goes by, we get closer to our vaccination goals. We have a better sense of where the virus is circulating in the community and what we can do to prevent that and how we can take a step forward each day, which is what we're trying to do.
On that, Chief Minister, there was reports last night that some schools may not anticipate seeing face-to-face learning returning for younger students at all in Term 4. Can you clarify if that's the case? Is that something parents should be prepared for?
I would dismiss that sort of speculation as being just that, speculation.
Greens crossbencher Andrew Braddock has sponsored a petition for the ACT government to provide financial support for those on federal income support. Is this something that the ACT government is considering? If not, why not?
We already do, and through a range of different mechanisms. So we have a hardship fund, we have payments available for people who need to isolate, even whilst awaiting a test result. We have assistance for those who are temporary visa holders and international students. This includes people on bridging visas, safe haven, enterprise visas, temporary protection visas, temporary work visas, student visas, and family visas. So we've looked to provide additional financial support above and beyond what the Commonwealth does, and often above and beyond what other states and territories do. In terms of people who are eligible for income support and required to isolate or quarantine, so people who are not accessing some of the other Commonwealth programs that provide additional income for those who've lost income because they can't work, in a circumstance where you are simply on a Services Australia or Centrelink payment, but you're not in the workforce and so you're not eligible for those other programs, there is a crisis payment available. And the information on that is available on the Services Australia website. We also provide assistance for lower income households, which all of the Commonwealth Centrelink payment recipients are eligible, through our utilities concession. And that's a way that we can provide a direct payment. At the moment, it's in the order of $750 to $800 a year. We'll be providing additional assistance through our budget that's now less than a month away.
As I understand, they want all job seeker payments to be supplemented, or have additional support from the ACT government. That's not something that's happening?
Well, we can't supplement through the Commonwealth scheme, but we can supplement people's incomes through our own schemes and our utilities concession and our hardship payments and our isolation payments and our support through organisations like the Red Cross, the Emergency Food Relief. We've got about 12 programs operating, many delivered in partnership with the community sector that provide support for people in that circumstance. But we're not duplicating the Commonwealth schemes. We're adding to them in certain instances and filling gaps for people who are not covered at all by any of the Commonwealth income support schemes. But the national arrangements that it is the Commonwealth Government who is responsible for income support for individuals, and we have a partnership around the delivery of other support across the community.
On business support, we understand that businesses that have multiple shop fronts but one ABN have only been able to make one application. For these businesses, the $10,000, they say, doesn't go terribly far.
Well, it's 20.
The $20,000, yes. Even so, perhaps may not go terribly far. Is there plans of work to provide additional support for businesses? You've said previously that there have been applications made or expressions of interest made to the Commonwealth. Has there been any progress on that?
Yes, we do intend to do more, and the details of that are being worked through with the Commonwealth.
Chief Minister, the Australian Institute of Health and Safety is calling on governments to mandate vaccinations for healthcare services staff. Is that something you'd consider as restrictions eased?
It's not so much linked to restrictions. I think it is more an issue around workplace health and safety and the obligations that are there to provide not only safe workplaces but also safe places for patients and people who are in care within certain health settings. So the precedent is there in relation to aged care workers. And we are, as an employer, working through the issues associated with, for example, hospital settings.
Chief Minister, when can we expect your daily press conferences to finish?
I don't know, Harry. I just don't know at this point. I'll be here tomorrow and on Sunday and through next week. There are a few people advising it might be appropriate that I take a day off at some point. Now, I can't do that entirely, as I obviously need to be chairing a range of meetings that occur every day, but whether I'm at this podium every day for the rest of time, I think we can say no confidently. I don't want to still be standing here doing a press conference with you on Christmas Day. I think we'd both like to be somewhere else then. But for the short term, at least the next week and probably beyond, we will continue to have press conferences like this, whether it's 7 days a week or we might only do one on a weekend rather than two, is something that we're considering.
I've had some people approach me asking about certain outdoor recreation, whether that will be, considered next week as part of it. So things like golf and that sort of thing, is that likely to be considered as something?
Yep.
On that, we get a lot of questions from our audience, and we understand that the rule of thumb is common sense, but the reasoning...
You're saying it's not always common, Harry, is it?
Even so, for some, with outdoor activities like golf or going to a national park, for instance, which is closed, what is the reasoning behind that?
Sure. There is I think I've addressed this at least half a dozen times, but let's go through it again. There's a cumulative question around movement in the community and the risk associated with that. And so every time we add something else in, that increases the movement and interaction of people, and so adds each bit incrementally to the totality of the risk that is measured both in terms of the transmission potential of the virus and in terms of its potential impact on our daily case numbers, on hospitalisation and on intensive care. So one of the factors that we need to balance here is a very strong desire from the government to focus the easing of restrictions on activities that get people back to work and get people back engaged in the economy. So that's a priority. I've mentioned before the number one priority is protecting public health. The number two priority is in advancing and easing restrictions and advancing through this outbreak is to ensure that we are doing what we can to get people back to work. The next most important thing clearly is mental health, recreation and safe activities that can occur. And things like golf and tennis and walking in national parks are all things that are next in line for consideration. They are relatively low risk, but they will see an increase in movement across the community. In relation to activities as specific as golf and tennis, it's not about having organised tournaments or having the Lynham Tennis Centre open so that 300 people can come and play tennis all at once. We need to be clear that this is not about a recommencement of organised sport, but it would be safe, managed, small gatherings. I understand that there is a set of protocols that worked reasonably well for golf courses, for example, last year, and so we would look to that as a starting point in terms of future restriction easing. It's on the agenda, it's being considered. We've definitely heard that these are activities that people would like to be able to resume in a COVID-safe way, and we would hope to be able to facilitate that in due course.
The same logic would then apply for why people aren't allowed to have gatherings in their backyard but can meet in a public park?
For example, yes. So, go to someone's house, you're very likely to need to use their bathroom and their facilities. You're going to be probably in their kitchen. There's a much higher risk. As the Chief Health Officer has outlined nearly every single day, most of our transmission is close household contacts. You invite people into your home, even if you very strictly say, oh, I've got a really big backyard and no one will go inside the house, the odds are as soon as we open up that sort of activity that we're going to see more transmission, because that's where it's occurring the most. And then the next most is in workplaces, which is why we've got to be really careful about how we gradually reopen certain industries.
While the word may have lost meaning for you now, the weekend is upon us. Some people are wondering about whether they can travel to another part of Canberra to partake in some of these recreational activities.
Well, again, let's go back to first principles. What are we trying to do here? We're trying to reduce the spread of the virus and the risk of transmission. So every time you move out of your area, every time you come into contact with someone else, it's a transmission risk. And so I appreciate that doing the same walk around the same parts of your local area is not necessarily the variety that everyone wants. And, believe me, I've walked a lot around where I live and a lot around where I work, and they're about the only places I go. Yes, it's frustrating, but I'm about to appeal to common sense again here, but the whole point of everything we've been doing is to reduce the risk of the virus transmitting. So if you're going outside your area, you're coming into contact with other people, you've just increased the risk. So preferably not. Please don't do it.
Yesterday you said the only thing keeping the ACT back from getting 95% vaccination rates was vaccine supply. And I know the government doesn't have a handle on how many on forward bookings at GPs and pharmacies, but just based off the forward bookings at the ACT government mass clinics, do you think 95% of Canberrans have booked that appointment?
Pretty close, yeah. I looked at yesterday's Commonwealth data, which is about 2 days behind ours. Pretty well every cohort above 50 was, either 94.8 or above 95%. The take-up amongst 40 to 49-year-olds who are still being vaccinated at the moment is approaching 90%. So yes, I think there's every reason to think that that trend will continue. May not be quite as high, like over 70s are at 98, 99%. We may not get to that level amongst people 16 to 29, but we don't need to in order to get to 90, 95 across the entire community. But look, again, if you are unvaccinated, you are at high risk. Just look at the data. Look at what's happening here, look at what's happening in Sydney, look at what's happening in Melbourne, in Victoria, across Australia, around the world. I saw the US President pleading with Americans on television this morning that this is a pandemic of the unvaccinated. If you are unvaccinated, you are at high risk. COVID is not something you want. It's not pleasant. And if you get it, you're likely to give it to your household, your friends and your work colleagues. And no one wants to be in that position.
Do you have the number of forward bookings that have been made at the LCT government mass vaccination?
I'm going to get this figure wrong. It's one of about 1,000 jumbling around my head. We will get it. I think from memory it was about 75,000, and that's just our part of the program. GPs obviously deliver a big part of it as well. On any given day, if you look at the Commonwealth data, we're doing over 3,000 through our mass vaccination clinics, but there's another 4,000 to 5,000 that are being delivered through primary healthcare. So at 7,000 or 8,000 a day, that's just going to continue. It's already booked in.
A couple for the Chief Health Officer, if that's
Certainly.
okay.
Thanks very much.
Dr. Coleman, do you possibly have a vaccination breakdown for the portion of the total cases? You mentioned the ones that were unvaccinated. Do you have any numbers for partially or fully?
I do. So just to go through those who are unvaccinated again, 361 of 463 cases, that's 78% are unvaccinated. We know that 43 of the 463, which is 9%, are partially vaccinated with one dose. We know that 20 of 463, or 4%, are fully vaccinated with 2 doses, and then we still have 39 or 8% to validate or to track down their details.
On some of the exposure locations listed, there was some particular interest about an adult store in Mitchell having been listed yesterday. Also now a pawn shop, that's PAWN pawn shop in Phillip as well, having been listed. These businesses operating as click and collect, and if so, why is the exposure period on those around about 45 minutes rather than what you would expect for a click and collect of a few minutes?
Yeah, sorry, I don't have any details on those particular exposure sites, so I can't answer that today.
More generally, though, when you are listing exposure sites for someone, whereas a business is a click and collect, for instance, so is there sort of a time either side that you're adding to the time that the person was there in order to capture additional people, just in case the times was wrong?
Yeah, exactly. Because we have really good check-in data for check-in CBR, and we don't have check-out data here in the ACT because of the burden we believe that puts on people to do. We do actually have a little bit of a window on either side to make sure that we capture that differences. We want to be more safe than sorry by making it too small.
As you said, the hospital numbers now kind of reflect the cumulative total of, cases and how they've passed. We've seen it jump a little bit in the last few days, and we're sitting at about 9% hospitalisation rate. Are you worried about that, and do you anticipate that to grow as you said, as that cumulative case numbers grow?
Yeah, so I think hospitalisation reflects two things. It reflects the epidemic as it continues to grow. So as we get more cases, there are more likely to be hospitalisations and therefore the total, and we are seeing very similar to what other jurisdictions are doing. I think also it does reflect on those people who are receiving transmission or who are cases, and we are seeing some vulnerable people in our community that we've discussed who are much more likely to be hospitalised than not. So yes, look, I think it is a little concerning to me that it is starting to rise a little bit, but the hospital system is definitely coping. There is no question there. It's more about trying to get everybody to understand the benefits of getting vaccinated, and the sooner we can get everyone vaccinated, the sooner everyone can be confident in their own protection.
What's the ref rate at the moment, and how does that affect your modelling? Are we in a place that you want to be at this point in the outbreak?
So there was an updated number provided yesterday, but as I had yesterday off, I actually haven't had a chance to review what our current ref rate is. We are under 1. But that is not much under 1. So leave it with me, and I think when we discuss early next week, as the Chief has outlaid, what we're looking like and what we might be doing next week, I can provide a little bit more context and information on that.
Just one for the Health Minister, if that's okay, please.
Great.
Minister, you mentioned about the new tech to speed up testing. Not after any specifics, but can you give us a ballpark, any idea of how much quicker this will make, I guess, the whole process, or any specifics?
So obviously increasing the capacity to 10,000 tests a day is a significant increase. So where we'll really see the impact of that is if we see another surge in the numbers of people coming forward for testing, where that number of test swabs being taken exceeds the daily capacity that we currently have within our system. So I can't give you a number on how much it's going to increase the turnaround time on a day-to-day basis. Our turnaround time for our testing has been absolutely outstanding over recent times, and the only time it's slowed down is when we've literally been taking more swabs than can be processed. So that's when it's really going to come into its own. But having this improvement in technology as well, as this technology continues to improve, it also just takes a bit of the workload off our teams. I can say, just for people's interest, one of the things that the team does do in order to speed up the process is to actually pool samples. So when a number of samples are collected, the first round is a pooled sample, and then if that pings as a potential positive, then they're all tested again separately to draw out which one was actually the positive within that pool. So then having the capacity to do more individual samples when we know that we have a risk in the community, that might also be a benefit here. So there are multiple benefits to having more capacity within the ACT pathology system.
Just for the Chief Police Officer, if I could.
Great.
The weather's supposed to be pretty great this weekend. Last weekend weather wasn't so great. So it might be the first real test of that 5-person outdoor recreation rule. For people who, are perhaps going for runs or picnics in busy areas such as the lake, what level of compliance, if any, could they be expected to see?
Look, our big focus is going to be on the wearing of face masks. Now, I understand that obviously if people are doing rigorous exercise, they can take the face mask off. But we also ask people to do the social distancing. So those rules haven't gone away. But those rules have remained since this pandemic commenced. So we ask people to actually maintain social distancing, wear their face masks, and keep to the groups of 5. I think they're fairly straightforward answers, and to that question. as the Chief has said before, it's all about stopping the spread of the virus. And if we can maintain those three things, I think we go a long way to defeating this.
There was some concerns a few days ago about workers wearing face masks properly. Has compliance on that improved any?
Yeah, so we're working with Access Canberra on that particular issue, and there has been a lot of education that's been undertaken with particularly restaurants. I think that was one of the main areas of concern, and we have seen an improvement. But I suppose the message I want to get out there that if we continue to see the same activity occurring time and time again in the same locations, we will move towards those fines. And as I've already said, we also have, if necessary, if there is a risk to public health, the ability to shut premises down. That is above building sites and construction sites. It does extend to other locations.
And compliance among businesses more generally, particularly I guess those retailers that aren't meant to be operating at the moment. Have you found any that have been outside of those rules at this point?
No, we have found that Canberrans overall have been overwhelmingly sticking to the rules, and again I thank people for that particular compliance, and we hope that it's maintained in the coming weeks. We've got to stay the course with this.
With Yass likely to come out of lockdown this weekend, are you concerned about its proximity to Canberra and potential compliance issues there?
Look, I think if I was a Canberran, I'd be more worried about what they think they can do about going to Yass. And I want to be pretty clear on this point, actually, is that Canberra is deemed to be a hotspot for New South Wales, so Canberrans cannot go to Yass. We have been speaking to the New South Wales Police about this issue this morning, and they've assured us that they will actually be looking at that particular issue and we'll see patrolling on the Barton Highway. I'm not concerned about people from Yass coming to Canberra because they can't, unless it's for an essential purpose and unless they have an exemption. So I think my message to Canberrans is you can't go to Yass, and we've got to, again, stick to the rules. Thank you.